Pregnancy is a time of joy and anticipation, but sometimes a shadow can cast itself over this beautiful experience. This shadow is anemia, a condition that affects far too many expectant mothers worldwide. Anemia occurs when the body doesn't have enough healthy red blood cells. These cells are crucial as they carry oxygen throughout the body, both for the mother and the developing baby. Anemia in pregnancy is a global concern, affecting women in both developed and developing countries. Its impact is far-reaching, potentially leading to complications for both mother and child. However, there's hope. With early detection, proper management, and preventive measures, we can help expectant mothers step out of anemia's shadow and into the light of a healthy pregnancy. This essay will explore the causes, symptoms, diagnosis, and treatment of anemia in pregnancy. We'll delve into the importance of preventive measures and the need for ongoing management. Remember, knowledge is power. Understanding anemia can empower expectant mothers to take charge of their health and ensure a safe and healthy journey to motherhood. Anemia during pregnancy isn't a one-size-fits-all condition. Various factors can contribute to its development, making it essential to understand the root causes. One of the most common culprits is iron deficiency. Iron is crucial for producing hemoglobin, the protein in red blood cells that carries oxygen. During pregnancy, the body's demand for iron skyrockets to support the growing baby and the mother's increased blood volume. If this demand isn't met through diet or supplements, iron deficiency anemia can develop. But iron deficiency is just one piece of the puzzle. Other factors, such as inadequate intake of other essential nutrients like folate and vitamin B12, can also lead to anemia. Additionally, certain medical conditions, blood loss, and even the physical changes during pregnancy itself can contribute to a drop in red blood cell count. Understanding the multifactorial nature of anemia is crucial for healthcare providers to develop personalized treatment plans. It also empowers expectant mothers to make informed decisions about their diet and lifestyle to prevent and manage this condition effectively. Anemia often creeps up silently, especially in its early stages. Many of its symptoms, like fatigue and shortness of breath, are often mistaken for the normal discomforts of pregnancy. However, it's crucial to pay attention to your body's signals and recognize the signs of anemia. One of the telltale signs is persistent tiredness, even after a good night's sleep. You might find yourself feeling constantly drained and lacking the energy to carry out daily activities. Another common symptom is paleness, particularly in the skin, lips, and nail beds. This paleness indicates a reduced number of red blood cells circulating in the body. Other symptoms include shortness of breath, even with minimal exertion, dizziness or lightheadedness, especially when standing up quickly, and a rapid or irregular heartbeat. Some women may also experience headaches, cold hands and feet, and difficulty concentrating. If you experience any of these symptoms, it's essential to consult your healthcare provider. They can assess your condition, determine the underlying cause, and recommend appropriate treatment strategies. Diagnosing anemia during pregnancy starts with a simple blood test during your prenatal checkups. This test measures the levels of hemoglobin, the protein in red blood cells that carries oxygen. A lower than normal hemoglobin level indicates anemia. However, diagnosing the specific type and cause of anemia requires further investigation. Your healthcare provider might recommend additional blood tests, such as a complete blood count or CBC. This test provides a detailed picture of your blood cells, including their size, shape, and number. Depending on the initial findings, your doctor might also suggest tests to check iron levels, vitamin B12 levels, and folate levels. These tests help identify specific deficiencies contributing to anemia. In some cases, further investigations might be necessary to rule out other underlying medical conditions. Early diagnosis is key to effectively managing anemia during pregnancy. Regular prenatal checkups, open communication with your healthcare provider, and prompt reporting of any symptoms can help ensure timely diagnosis and treatment. Once anemia is diagnosed, the treatment approach depends on the cause and severity. In many cases, dietary modifications play a crucial role in replenishing iron stores and improving hemoglobin levels. Incorporating iron-rich foods into your diet can significantly impact your iron levels. Excellent sources of iron include red meat, fish, poultry, beans, lentils, tofu, spinach, and fortified cereals. Combining these iron-rich foods with vitamin C-rich foods, such as citrus fruits, strawberries, and tomatoes, can enhance iron absorption. However, it's important to note that the iron from plant-based sources is not as easily absorbed as the iron from animal sources. Consuming plant-based iron sources with a source of vitamin C can help improve absorption. On the other hand, certain foods and beverages such as tea, coffee, and calcium-rich foods can hinder iron absorption and should be consumed separately from iron-rich meals. Making these dietary changes can go a long way in preventing and managing anemia. However, dietary changes alone might not be sufficient in all cases. Your healthcare provider might recommend iron supplements to further boost your iron levels. Section 6. Iron supplements, boosting iron levels. While dietary changes are essential, they might not always be enough to replenish iron stores, especially if anemia is already present. In such cases, iron supplements become a crucial part of the treatment plan. Iron supplements come in various forms, including tablets, capsules, and liquids. Your healthcare provider will determine the appropriate dosage and type of iron supplement based on your individual needs and the severity of your anemia. It's important to follow your healthcare provider's instructions carefully regarding dosage and frequency. Taking iron supplements on an empty stomach generally improves absorption, but can cause stomach upset in some people. If you experience discomfort, you can take iron supplements with a small amount of food. However, avoid consuming them with calcium-rich foods or beverages, as they can interfere with iron absorption. Iron supplements are generally safe and effective when taken as directed. However, they can cause side effects such as constipation, diarrhea, nausea, and stomach cramps. If you experience any side effects, inform your healthcare provider. They might suggest adjusting the dosage or switching to a different type of iron supplement. Section 7. Intravenous iron therapy. For when a quick fix is needed. In some cases, oral iron supplements might not be sufficient to correct anemia, especially if it's severe or if the body isn't absorbing iron effectively. In such situations, intravenous iron therapy might be recommended. Intravenous iron therapy involves delivering iron directly into the bloodstream through a vein. This method allows for rapid iron replenishment and is particularly beneficial for women who cannot tolerate oral iron supplements or require a quick increase in iron levels. Intravenous iron therapy is generally safe, but can cause side effects such as low blood pressure, headache, dizziness, nausea, and allergic reactions. Therefore, it's usually administered in a healthcare setting under close monitoring. Intravenous iron therapy is a valuable tool for managing severe anemia or cases where oral iron supplements are ineffective. Your healthcare provider will determine if this treatment option is right for you based on your individual circumstances. Section 8. Preventing anemia. A stitch in time. Preventing anemia is always better than treating it, especially during pregnancy. By adopting healthy habits and making informed choices, you can significantly reduce your risk of developing this condition. One of the most effective preventive measures is consuming a balanced diet rich in iron and other essential nutrients. Include plenty of iron-rich foods in your meals and snacks, and combine them with vitamin C-rich foods to enhance absorption. Taking prenatal vitamins as prescribed by your healthcare provider is another crucial step in preventing anemia. Prenatal vitamins typically contain iron and other essential nutrients, such as folic acid, which are crucial for a healthy pregnancy. In addition to diet and supplements, lifestyle factors also play a role in preventing anemia. Getting enough sleep, staying hydrated, and engaging in regular physical activity can all contribute to maintaining healthy iron levels. Section 9. A lifelong commitment, ongoing management, and seeking expert guidance. Managing anemia during pregnancy is not a one-time event, but rather an ongoing commitment. Regular monitoring, follow-up appointments, and open communication with your healthcare provider are crucial for successful management. Your healthcare provider will continue to monitor your hemoglobin levels throughout your pregnancy through regular blood tests. Based on these results, they might adjust your treatment plan, such as modifying the dosage of iron supplements or recommending dietary changes. It's essential to remember that anemia management doesn't end with pregnancy. Maintaining healthy iron levels is crucial even after delivery, especially if you are breastfeeding. Your healthcare provider can guide you on the appropriate dietary and lifestyle modifications to ensure adequate iron intake during the postpartum period. Remember, managing anemia during pregnancy is a team effort. By working closely with your healthcare provider, staying informed, and taking proactive steps to prioritize your health, you can navigate this condition effectively and embrace the joys of motherhood with confidence.